Have you ever looked at your dog, maybe noticed they're suddenly, I don't know, super thirsty or always hungry and just thought, well, they're just getting older.
Right, it happens all the time.
But those little things, those subtle shifts, they could actually be clues. They might be pointing towards something called Cushing syndrome.
Also known as hyperadrenocorticism, yeah.
It sounds complicated, but it's actually a pretty common endocrine issue in dogs.
And it can really impact their health and quality of life. So today we're doing a deep dive, really getting into this hormonal mystery.
Absolutely. So at its core, Cushing's just means the dog's body is making way too much of a hormone called cortisol.
Cortisol.
Yeah.
I know that's involved in stress.
It is, yeah. Normally, cortisol is super important. It helps dogs handle stress, manage weight, fight infections, even keeps blood sugar levels balanced. It's a vital tool.
Okay.
But, like any tool, right? Too much of it or even too little, that's where the problems start. So our goal today is really to help you understand this condition better, make sense of those maybe confusing signs. Okay, so let's unpack this. If there's too much cortisol, where is it actually coming from? Like, what parts of the body are involved here?
Good question. There are two key players. You've got the adrenal glands, these little glands near the kidneys. They're the ones that actually produce the cortisol.
The cortisol factories, basically.
Exactly. And then you have the pituitary gland. It's tiny, like pea-sized, right at the base of the brain. Think of it as the manager controlling the adrenal glands.
Okay, so how does that relationship normally work? And, what goes wrong with Cushing's? Is it like a faulty thermostat or something?
That's a great way to think about it.
Yeah.
Normally, it's a really neat feedback loop. The pituitary gland sends out a hormone, ACTH, which basically tells the adrenals, okay, make some cortisol.
Right.
The adrenals do their job. Then, when there's enough cortisol floating around, the adrenals signal back to the pituitary like, okay, we're good. You can ease up on the ACTH. It keeps everything in balance.
Like that thermostat maintaining the right temperature.
Precisely. But with Cushing's, that system breaks down. The feedback isn't working.
So the thermostat's broken and just keeps cranking out heat.
Exactly. The adrenal glands just keep getting the signal to make more and more cortisol, even when it's not needed. And that overload causes all the issues we see.
Okay, and you mentioned this gets interesting. Cushing's isn't just one single thing, right? There are different types.
Yes, absolutely crucial to understand this. There are three main types, and they have different root causes.
Okay.
The most common one, like 80 to 90% of cases, is called pituitary-dependent hyperadrenocorticism, PDH for short.
Pituitary dependent. So the problem starts in the brain, not the adrenal glands.
Exactly. That surprises a lot of people. It's usually caused by a small tumor on that tiny pituitary gland, and most of the time it's benign, so non-cancerous.
Okay.
But this little tumor acts like a rogue boss, pumping out way too much ACTH, constantly telling the adrenal glands, more cortisol, so the adrenals actually get bigger because they're working overtime.
Wow. Okay, so that's the most common. What are the others?
The second type is adrenal-dependent hyperadrenocorticism. Less common, maybe 10 to 20%. Here, the problem is in the adrenal gland itself.
Okay.
There's a tumor directly on one of the adrenal glands, and that tumor is churning out excess cortisol, totally ignoring the pituitary signals. These adrenal tumors, they can be benign or malignant, meaning cancerous. And if they're malignant, they can potentially spread.
Right. That sounds more serious, potentially.
It can be, yeah. And then the third type is quite different. It's called iatrogenic Cushing's syndrome.
Iatrogenic. What does that mean?
It basically means it's caused by medical treatment, specifically long-term, high-dose use of external steroid medications, like prednisone.
Oh, wow. So drugs given for other things, like allergies?
Exactly. Allergies, immune disorders, things like that.
Yeah.
If a dog is on high doses of steroids for a long time, their body essentially reacts as if it has Cushing's because of that overload of steroid hormone.
That's kind of ironic. A treatment causing a condition that mimics the disease.
It really highlights how important careful medication management is,
Yeah.
Always follow the vet's instructions precisely.
Definitely. So, thinking about who gets this, are certain dogs more likely to develop Cushing's?
Yeah, there are definitely some trends. Age is a big one. We usually see it in middle age to older dogs,
Yeah.
typically around 7 to 12 years old.
Okay, makes sense. Any particular breeds?
For the pituitary type, the really common one, smaller breeds seem more prone. Think miniature poodles, dachshunds, boxers, Boston Terriers, Yorkies, Staffies, those kinds of dogs.
Interesting.
Adrenal tumors can happen in medium and larger breeds too, though. And then some breeds seem less likely, like Goldens, Labs, Border Collies, Cocker Spaniels. Genetics definitely plays a part.
What about male versus female?
Some studies suggest females might be slightly more affected, maybe around 75% of cases, but other research hasn't really found a strong link. So the jury's still out a bit on that one.
And quickly, you mentioned cats.
Right, it's much rarer in cats, but it can happen. Similar pattern, usually pituitary-dependent, older cats.
Got it. So let's bring this back to the owner. What are the actual signs someone might notice at home? What should make you think, maybe I should get this checked out? It sounds like it could be subtle at first.
It really can be. Often the very first things people notice are increased thirst and urination. Like you're filling the water bowl constantly, or your dog suddenly needs to go out way more often, maybe even having accidents inside or waking you up at night.
Like a little leaky faucet?
Kind of. And it happens because the high cortisol messes with how the kidneys handle water. So they just produce more urine.
Okay, what else?
Increased appetite is another big one. Polyphagia, the technical term. Your dog might seem ravenous all the time, maybe even start guarding their food bowl. Cortisol directly stimulates hunger.
Right.
Then there's the pot-bellied look, a sagging, rounded belly, even if the dog hasn't actually gained much weight overall.
Yeah.
That's a mix of things: weak abdominal muscles, the liver might get enlarged, fat gets redistributed to the belly, and sometimes just a really full bladder from all the drinking.
I've definitely seen dogs that look like that.
Yeah, it's quite characteristic. Hair loss is another key sign. Often it's symmetrical, on both sides of the body, the flanks, the tail. Sometimes they only have fur left on their head and feet. The hair just stops growing properly.
Okay.
Lethargy. Muscle weakness, too. They might seem tired, less active, struggle to jump up or climb stairs. Cortisol actually breaks down muscle tissue.
That explains the weakness.
And excessive panting, even when they're just resting. That can be from the muscle weakness affecting their breathing muscles or cortisol affecting the brain's breathing control.
Wow, it affects so many things.
It really does. Skin changes are common, too. Thin, fragile skin, wounds that heal slowly, maybe chronic skin infections, blackheads, dark patches. In dogs, sometimes you even see this weird calcification in the skin. Calcinosis cutis feels like hard little plates under the skin.
Yikes.
And then there are other potential issues: recurrent UTIs because the immune system is weaker, a higher risk of developing diabetes, especially in cats with Cushing's, high blood pressure, even dangerous blood clots.
So it's not just about the obvious symptoms. There can be serious underlying risks.
Absolutely. And your vet might also see clues in routine blood tests, like high liver enzymes, particularly one called ALP in dogs, high cholesterol, maybe high blood sugar, changes in white blood cells. And the urine often looks very dilute on tests. It all helps build the picture.
That's a lot of potential signs. So if an owner sees some of these and they go to the vet, how do you actually confirm it's Cushing's? You said it overlaps with other things, right? Why isn't there just one simple blood test?
That's a fantastic question. And it really hits on why diagnosing Cushing's can be, well, a bit of a challenge. So many of those signs, drinking more, slowing down, skin issues, they can happen with other conditions, especially in older dogs. Kidney disease, diabetes, thyroid problems.
So you have to rule those out first.
Exactly. There's no single Cushing's test. It's more about putting together the puzzle pieces, the clinical signs you're seeing at home, the vet's physical exam findings, and then a series of specific tests. So the vet will start with a really thorough history and exam, then basic blood work and a urine test, looking for those initial clues like the high liver enzymes we mentioned or really dilute urine. Sometimes imaging helps too. X-rays might show an enlarged liver, and an ultrasound is really useful for looking directly at the adrenal glands, checking their size, looking for any tumors.
So that's the initial screening. What about the specific hormone tests?
Right. Then we need to dig deeper into the hormones. One common screening test is the urine cortisol creatinine ratio, the UCCR. It measures cortisol in the urine.
Is that done at the vet's office?
Ideally, no. The best way is for the owner to collect a first morning urine sample at home. That avoids the stress of a vet visit, which can artificially spike cortisol levels, right?
Oh, makes sense.
So this UCCR test is pretty sensitive, meaning if it's negative, Cushing's is unlikely. But it's not very specific. Other illnesses or stress can make it positive. So if it is high, it tells us, okay, we need to investigate further.
Yeah.
It doesn't confirm Cushing's on its own.
Gotcha. So what's next then?
Then we move to more specific tests. One is the ACTH stimulation test. Remember, ACTH is the hormone from the pituitary that tells the adrenals to work.
Yeah.
In this test, we give the dog an injection of synthetic ACTH and measure their cortisol levels before and after. It shows us how responsive the adrenal glands are. It's like giving them a direct order to see how much cortisol they can pump out. This test is pretty good for diagnosing the iatrogenic type caused by steroids, too.
Okay. And you mentioned another one.
Yes, the low-dose dexamethasone suppression test, or LDDST. This is often considered kind of the gold standard screening test for many vets.
How does that one work?
So dexamethasone is a synthetic cortisol. We give a very small dose. In a healthy dog, their body should recognize this extra cortisol and say, okay, we have enough, shut down our own production. Their pituitary should stop sending ACTH, and their adrenal glands should stop making cortisol.
The feedback loop kicking in.
Exactly. So we measure cortisol levels before the injection, and then again several hours later, usually at 4 and 8 hours. In a dog with Cushing's, that suppression mechanism is faulty. Either their cortisol levels don't drop like they should, or maybe they drop initially but then escape suppression later on. That lack of normal suppression points strongly towards Cushing's.
Right, the off switch isn't working.
You got it. Now, once we suspect Cushing's based on these tests, sometimes we need to figure out which type it is, the pituitary kind or the adrenal tumor kind. That can influence treatment.
How do you tell us apart?
A few ways. Sometimes the LDDST pattern gives clues, or we might do a high-dose dexamethasone suppression test. Similar idea, but a much bigger dose of dexamethasone. The thinking is a pituitary tumor might still respond partially to a very high dose and suppress cortisol production a bit, whereas an adrenal tumor usually won't suppress at all. It's just doing its own thing.
But not always clear-cut.
Not always, no. Some big pituitary tumors might not suppress even with the high dose. Another really useful test is to measure the dog's own endogenous ACTH level in the blood.
Ah, okay. How does that help?
Well, think about it. If the problem is an adrenal tumor pumping out cortisol independently, the pituitary gland should sense all that cortisol and stop producing ACTH. So ACTH levels will be really low, maybe even undetectable.
Right.
But if the problem is a pituitary tumor overproducing ACTH, then the ACTH levels will be normal or even high. That distinction can be very helpful.
That makes sense.
And finally, advanced imaging like a CT scan or an MRI can give us a direct look. They can visualize a tiny tumor in the pituitary gland or find a tumor on an adrenal gland and check if it looks like it might have spread. It's definitely a detective process.
It really sounds like it. A lot of steps to get a clear answer. But okay, once you have that diagnosis, what can actually be done? What are the treatment options?
The good news is, Cushing's is usually manageable. Treatment aims to reduce the amount of cortisol being produced, control the symptoms, and give the dog a good quality of life. But it definitely needs a tailored plan with your vet. For most dogs, especially the common pituitary type, medical management is the way to go. The main drug used now, and it's FDA approved, is called Trilostane. Brand name is often Vetoryl.
How does Trilostane work?
It basically works inside the adrenal glands to reduce the amount of cortisol they can produce. It doesn't cure the underlying tumor, but it controls the effects of the excess cortisol.
Is it a one-time thing?
No, it's a lifelong medication, usually given once or twice a day, and importantly, it needs to be given with food for proper absorption.
And are there side effects?
Yes, and this is really important. Owners must monitor closely. Because it lowers cortisol, you need to watch for signs that it might be working too well, making cortisol levels dangerously low. Things like lethargy, vomiting, diarrhea, lack of appetite. If you see those, you need to stop the medication and call the vet immediately.
So regular checkups are key.
Absolutely essential. Regular blood tests, usually ACTH stimulation tests, are needed to monitor the cortisol levels and adjust the Trilostane dose to keep it in the safe and effective range. It's a balancing act.
Okay. Are there other medications?
There's an older drug called midutane, or Lysodren. It actually works by selectively destroying some of the cortisol-producing cells in the adrenal glands. It can be effective, but it potentially has more side effects and requires even more intensive monitoring, especially at the start. It's used less commonly now for typical Cushing's, but might still have a role in specific situations.
Got it. What about surgery? You mentioned tumors.
Right. Surgery is mainly an option for the adrenal-dependent type, where there's a tumor on one adrenal gland. If the tumor is benign and hasn't spread, surgically removing that affected adrenal gland and adrenalectomy can actually be curative.
Wow, a cure?
Potentially, yes, but it's a major complex surgery. Adrenal glands are tricky things to operate on near big blood vessels. There are significant risks, like bleeding or the dog's cortisol levels plummeting dangerously right after surgery. It's also expensive and needs a specialist surgeon.
So a big decision.
Definitely. For pituitary tumors, surgery to remove the pituitary tumor itself, hypophysectomy, is technically possible. It can lead to a rapid reversal of signs and a great outcome. But it's only done at a very few highly specialized centers. It's very expensive, and it has its own set of potential complications and needs for lifelong hormone replacement after.
Okay, so less common.
Much less common. Sometimes radiotherapy, radiation treatment is used for pituitary tumors, especially if they're large and causing neurological problems like seizures or blindness. It can shrink the tumor, but the effects on cortisol levels might take months, and dogs often still need medication like Trilostane alongside it.
And what about the iatrogenic type from steroid medication?
Ah, that's completely different. The treatment there is simply to carefully and gradually reduce the dose of the steroid medication causing the problem. You can't just stop steroids abruptly. That can be really dangerous. It has to be tapered off under veterinary guidance.
Makes sense. Any role for diet?
Sometimes. Dogs with Cushing's often have high cholesterol or triglycerides in their blood, so a lower-fat prescription diet might be recommended by the vet to help manage that aspect.
Okay, so putting it all together, what's the long-term outlook? If a dog is diagnosed and treated, what can owners realistically expect day to day?
With the right diagnosis, treatment, and really importantly, consistent monitoring, the outlook is generally good. Most dogs can have a very good quality of life. Owners usually see improvements pretty quickly in things like drinking, urinating, and appetite, maybe within a few weeks of starting medication like Trilostane.
That must be a relief.
It really is. The skin and hair coat changes take longer, though. That can take several months to improve, so owners need a bit of patience there.
And life expectancy.
It varies, of course, depending on the type, the treatment, other health issues. But for dogs with pituitary Cushing's managed well with medication, the median survival time is often around 2 to 3 years after diagnosis, maybe even a bit longer, with really optimized therapy these days. For adrenal tumors successfully removed surgically, survival can range maybe from 1.5 up to 4 years, sometimes longer. So, meaningful time with good quality of life is definitely achievable.
That's good to hear, but it sounds like it requires ongoing commitment.
Absolutely. That's the key takeaway. It's almost always a lifelong condition requiring lifelong medication and monitoring. Regular vet checkups, maybe every 3-6 months, once stable, and those monitoring blood tests are crucial to make sure the dose is right.
And the owner's role.
Hugely important. You're the one seeing your dog every day. You need to watch for any return of the Cushing's symptoms, track things like water intake, and crucially, know those signs of the medication potentially lowering cortisol too much. The lethargy, vomiting, diarrhea. Contacting the vet immediately if those happen is vital.
What happens if it's not treated?
Well, the symptoms just get progressively worse. The excessive drinking, panting, weakness, skin problems, it really impacts their quality of life negatively. And untreated dogs are at much higher risk for those serious complications we talked about. Diabetes, high blood pressure, pancreatitis, blood clots. Some of those can be life-threatening.
So treatment really is important.
It really is, for both quality and quantity of life. It's also fair to mention that managing Cushing's long-term does involve an ongoing financial commitment for the medication and the necessary vet visits and tests. That's something owners need to be prepared for.
This has been incredibly informative. It really shows how paying attention to those maybe small changes in our pets, things we might just brush off as getting old, can be so important. It can be the first step to find a condition like Cushing's that, while serious, is often very treatable.
Exactly. It's fascinating how those subtle shifts, drinking a bit more, belly looking a bit rounder, can point to such a complex hormonal issue. It really makes you think, doesn't it?
Yeah.
How much are we really observing and interpreting about our pet's health versus just making assumptions? Your awareness as an owner can make a world of difference in catching things early.
Absolutely. Now, just a reminder to everyone listening, while we hope this deep dive has been helpful and educational, it's definitely not a substitute for professional veterinary advice.
Couldn't agree more. If you notice any of these signs or have any concerns at all about your pet's health, please always consult with your veterinarian. They're the only ones who can properly diagnose your dog and recommend the best course of treatment for their specific situation.
They are absolutely your best resource for personalized care for your furry family member.